Thank you, Lauren. We got that recording in progress. The first thing I want to mention just before I introduce our speakers is to make sure that everybody has the captions. If you're having any trouble with the captions, go to the bottom of your screen and there's a string of icons. You go to show captions, just click on the CC. It may ask you to choose how you want it to look, but they're not too hard to get. If you want to use screen text, which is a larger version that some people like on a separate screen, like on an iPad, there's a link to the stream text in the chat. So I hope everybody is able to hear or follow along in captions. I want to ask you also, I think pretty much everybody is muted, but please keep yourself muted except when you're asking questions. And the mute is the little microphone icon on the bottom left on a computer. I'm not sure what it is on a phone. And when we get to the Q&A to ask a question, the best way, it's very hard, and we have quite a few people here, it's very hard to actually see hands physically raised like this. So if you would go to reactions, click on that, you'll see a hand icon. So just click on that. That lines you up at the top of my screen so I know in what order you were here to ask your questions. So that's all for the announcements. I want to briefly introduce our speakers because I know we have a lot of material to get through. Our speakers tonight, we have two, are Dr. Thomas Powers, who is an expert on over-the-counter hearing aids, and Dr. Barbara Weinstein. Dr. Powers and Dr. Weinstein are both audiologists. Dr. Weinstein is also a consultant and educator and a former professional advisor to the chapter. Dr. Powers is also the founder and managing member of Powers Consulting, which provides management consulting to the hearing aid industry, the hearing health industry. He'll discuss issues related to over-the-counter devices, including the availability of return policy, reviewing technical specifications, how to find the right device for you, and how to buy it. Dr. Weinstein, in addition to being our former professional advisor and all the other things she is the founding executive officer of the Health Sciences Doctoral Program at the CUNY Graduate Center. And she also holds a position as adjunct professor of medicine at NYU Langone Medical Center. Dr. Weinstein will speak about new developments in hearing aids for more serious hearing loss. What we haven't really settled, I don't think yet, on the term for those, but I think of them as prescription hearing aids as opposed to over-the-counter hearing aids. I want to ask that everybody hold your questions until both the presenters have gone through their slides. And at that point, we'll call on each of you in order. And we didn't actually discuss what order, Barbara and Tom, you want to go in.
So I was wondering if I could start. So Tom, I was wondering if I could start first, only because I really, my presentation is really going to be kind of like what led up to the development of the OTC.
Okay.
And I think it's kind
great.
of relevant. So
okay, that sounds good. Over to you. Thank you so much.
Okay. So let's try this share again. Okay. Okay, so as we all know, OTC is a new pathway to care for people with hearing loss. And as I will discuss, there is a need for a new pathway to care because of the low uptake of hearing aids, and that's what I want to build up to. So, as we all know, hearing loss has many faces. Hearing loss is invisible. Restaurants are an auditory nightmare. Zoom sessions can be difficult. Oftentimes you mishear what a physician is saying, restricts sense of safety. It's stigmatizing, and it also, sometimes leads people to socially disconnect. But we all know that hearing is important. You folks know this, but most people don't appreciate the fact that hearing is a social sense We need it to communicate and remain engaged and connected to everyone. It helps us remain aware of our environment, yet hearing is undervalued, underrecognized, and hearing loss is undertreated. Hearing loss recently, especially, has become a big scientific topic. As you know, there's a lot written about the ear and the brain. Hearing loss is a big emotional topic because there's a loss, and also there's a lot of stigma associated. People feel the stigma associated with hearing loss, and hearing loss is considered by some to be a disability and an accessibility area that's not addressed as it should be. And as you all know, there are many invisible burdens of hearing loss, which I'm sure you can all identify with. I'm speaking to the choir here, but there's listening fatigue. You worry that you miss things. When you exercise, the hearing aid could get sweaty. Difficulty sometimes communicating over the smartphone, missing out on conversations. So there are many invisible burdens that only people with hearing loss or people who have family members who live with them can appreciate the significance of hearing loss. So hearing loss, though, is stigmatized, and it's been stigmatized for the ages. One of the stigmas now, there's a lot of scientific evidence suggesting, misrepresenting the fact that hearing loss is a prelude to dementia, and the stigma of hearing loss alone, and then there's a stigma of hearing aids as a sign of aging. And most people don't appreciate the benefits or the value of treating hearing loss versus the problems associated with untreated hearing loss. It's a positive trajectory when we treat hearing loss. The untreated hearing loss has many negative consequences that people have not been aware of for the longest time. So, for example, what we know now is that despite growing efforts from hearing healthcare advocates to raise consumer awareness, only a quarter of Americans, according to a Harris poll, recognize that hearing loss can impact overall health. According to the Harris poll, a recent Harris poll, only 38% say they worry that about hearing loss as they age. And most people who responded to this recent Harris poll said that they were more concerned about eyesight decline, they were more concerned about their balance and falls and weight gain than they were about hearing loss. And here we see an interesting slide demonstrating how hearing is undervalued. And here we have the activity on this axis over here, and then we have the proportion of respondents. And we have the green column, the green bar is people with hearing loss, and then we have people without hearing loss. And it doesn't matter hearing with hearing loss or without hearing loss. In terms of priorities of health, the people between 50 and 80, what people prioritize with hearing loss, without hearing loss, their physical health, their cholesterol level, their eye situation, their exercise routines, taking their pet to a vet, and then we have hearing right here. So hearing is so undervalued, it's undertreated, and it's undervalued by people with and without hearing loss. So this has been a problem, which finally we got the government to respond, which is, as you'll see, has led up to this OTC situation. People with hearing loss are twice as likely to report that their mental health is fair or poor as compared to those without hearing loss. And 45% of adults age 50 said they would have been more worried about potential hearing loss early in life had they known that there were significant consequences. What this recent Harris poll suggested is that what we know now is that 55% say hearing loss affects their ability to enjoy entertainment. 42% say it affects their social life. 40% say it affects their personal relationships, and affects mental health, and it also negatively affects the ability to conduct day-to-day activities. So it's more and more recognized that it's problematic here. 27% of people responding to the poll said they have difficulty hearing. The difficulty hearing has refrained them from getting a hearing aid was their doctor has not told them they need hearing aids. And only a small proportion of people who could benefit from hearing aids use them. Physicians are not, it's not recommended that physicians routinely screen for hearing loss unless a patient complains that they have hearing loss. So it's not recommended by the United States Preventive Services Task Force that hearing is routinely screened, although the World Health Organization recently recommended it. So, but now we know, and this is thanks to the FDA and the NIA and that we know that it's important to take action. It's hearing and communication is important in terms of health, personal safety. It's important for enjoyment of music, ability to communicate successfully, the ability to participate, remain engaged and active, and it's important for social connectedness and richness of one's social environment. What we know now is that the greatest predictor of longevity is social connectedness and social engagement. So people who live longer are the ones who are socially engaged. And we also know that social engagement is protective against cognitive decline. So as audiologists, we should, in addition to recommending hearing aids and cochlear implant, we have to encourage social connections and social engagement. And that's something called social prescribing, which more and more are doing. And you're all ahead of the curve. I'm preaching to the choir again. So as you know, we have many different approaches to hearing rehabilitation. We have a spectrum of interventions, depending on the degree and severity of the hearing loss. We can recommend communication strategies, which after Tom finishes his presentation, I could discuss. We can go with prescription hearing aids, or we can go with over-the-counter hearing aids. And hearing protection, of course, is very, very important. But we have all these interventions, but the stigma of hearing aids goes back to 1949, and the utilization of hearing aids in terms of proportion of users has not changed for decades. So here we have a 1949 excerpt about hearing aids. All is vanity. He wears a hat with a hard, tight rim, but a hearing aid headband, not for him. Her earrings pinch and they're as big as dollars, but a tiny earpiece, no, she hollers. His pocket bulges with a horrid litter. He hasn't room for a small transmitter. She squirms and scowls with the strain she brooks, but she's sure that an aid would spoil her looks. Vanity, vanity, all is vanity, and vain is aid for vain humanity. So this is from 1949. So stigma has not changed at all. And here we see some examples of hearing aid ads. Just the idea is to make the hearing aid invisible, continue to make hearing loss invisible because of the stigma, which goes back so many years. So, and here we have a little bit of a slide showing use of hearing aids, and hearing aid use in terms of proportion of users is so low. It's remained about 20 to 25% since 1950. So hearing aid use in terms of proportion of users it remains steady despite the fantastic technological advances. And there's a lot of rumors out there about hearing aids and how people you hear the bad things about hearing aids. People never hear the good things about hearing aids or the benefits. Physicians don't hear about the good about hearing aids. They only hear the bad about hearing aids. And that leads to the underutilization of the traditional prescription hearing aids. And here we have from a report from the National Council on Aging. This contributes more to the stigma and contributes more to the challenge of getting people to help themselves. Hearing aids are expensive, they're hard to use, they don't work well, they don't have enough features, I don't like how they look, and they're uncomfortable. So despite all the advances, the manufacturers are trying to make them smaller and smaller, increasing stigma. There's so many the hearing aids get a very, very bad rep despite the advantages that we all know about. And here we know about prescription hearing aids, which there are two categories of hearing aids. We have prescription hearing aids and we have over-the-counter hearing aids. And prescription hearing aids are the effective treatment for hearing difficulties, but readiness and realistic expectations must prevail if people are going to be successful. And the longer the time frame between the onset of hearing loss and initiation of hearing aid use, the more difficult to adjust. And people don't appreciate the fact that with prescription hearing aids, you need time to adapt. And oftentimes people lose patience. And there are different ways of people adjusting to hearing aids. And many of you probably got hearing aids first when you were told to gradually adjust to hearing aids. But now we have a philosophy of total immersion. Take the hearing aid, wear it all the time. But for some people, that's not beneficial. And for many people, they may reject them because the gradual adjustment may be better for these people. So, but total immersion is what we recommend now because we think that daily exposure of the auditory system to all sound frequencies may assist the brain in learning to process speech sounds being heard once again. And maybe it's not good for people to get total immersion because it may pose a problem for people who cannot tolerate the auditory noise, new noises, new sounds, may be physically uncomfortable. So people need a longer time frame. So there are many reasons why people are rejecting it. Could be our approach. But what we have to appreciate is the fact that it's important not to abandon the process. And for many people who abandon the process, they may turn to OTC, or many people don't want to proceed because hearing aids are too expensive. Then they may embrace OTC hearing aids. So OTC hearing aids were developed, came on the market. The Food and Drug Administration recommended them from a conference that I actually attended to in about 2016, because we want to make sure that hearing aids are accessible, and affordable. So that's why OTC has come on the market. And I'm not going to, Tom, I'm just going to define this and then you can go. And then, so OTC hearing aids, an OTC hearing aid is an air conduction hearing aid intended for adults aged 18 and older with a self-perceived mild to moderate hearing loss. What's important here is that it's a self-perceived mild to moderate hearing loss, meaning you don't have to go to an audiologist to get your hearing checked to get an OTC hearing aid. The goal of the OTC is lower prices. They want to there's a goal is to try to increase innovation, increase competition against manufacturers, and make hearing technology more accessible to the millions of Americans who need them. And I just want to say that for people who can benefit from hearing aids, from the OTC hearing aids, which I know Tom is going to discuss shortly, and then I can go back to some other slides. It's for people who have difficulty communicating in noisy places. They might have difficulty in groups, might have difficulty on the phone. Listening may make them tired and fatigued, may have to turn up the volume control. And other people may complain that the TV is too loud. And it's also for people who don't necessarily need devices in all situations, but just in some situations. Many people have prescription hearing aids are candidates, but as a starter device, these are the people who might be interested in OTC hearing aids. But what we have to remember is that there are red flag indications for when people should not embrace OTC hearing aids. So OTC hearing aids are not recommended for people that might have a birth defect or an ear that's an unusual shape. A person who's had an injury to the ear, some sort of an accident, not a candidate for these devices. If there's blood or fluid coming out of the ear, not a candidate. If there's any pain or discomfort in the ear, these people are not candidates. If the people are complaining of dizziness or imbalance, ringing in the ears, not a candidate. Hearing has a sudden hearing loss, a sudden change in hearing loss, shouldn't get an OTC hearing aid. If hearing has changed over time, not get a hearing aid. Hearing is worse in one ear, not get a hearing aid. These are red flags, and these are individuals who should be encouraged to go see a physician before they proceed with any kind of technology. And so again, an OTC versus prescription. An OTC is any hearing aid. A prescription hearing aid is any hearing aid that's not OTC. And prescription hearing aids are only available through a licensed healthcare professional who can program the device to your unique level of hearing loss, and appropriate for all levels of hearing loss and for all ages based on the indications for use. And what's important about prescription hearing aids is that audiologists assess hearing aid fittings with something called RealEar to make sure they have enough gain that they're giving the person so that the hearing loss is compensated for. But what's really, really important to know is that sometimes there are changes over time in people's ears. There are changes over time as people age. There is some degeneration that takes place. So sometimes the signal processing that was recommended early on is not going to be agreeable to some people as they age, and audiologists have to make sure to monitor, and you should make sure to go back to the audiologist if you notice a change, because there is signal processing that may not agree with people, how the signal is processed may not agree with people as they age. So it's important to keep going back to the audiologist for cochlear implant, of course, recalibrating, and also for hearing aids if you notice any difficulty. And I think what I'll do is I'll turn it over to Tom, and then I can come back and talk about some other things.
Okay, let's see if I can get mine to see my screen here. Okay. Hopefully you can all see the slides now. That's a yes. Okay, good. All right. So what I'm going to try to do is sort of pick up a little bit and maybe a little duplication, but not much. OTC, where are we now? First, to tell you where we are now, where I am right now, sitting in that room you see in the upper left, this is my little farmhouse out here in Northwest New Jersey. And you can see from the cornerstone, this house was built in 1843. I've been here about 25 years, and I have a little farm and I have sheep. So that's my hobby. So, most people, I think, talk today about, I think OTC originally thought this was going to be a revolution, and that somehow this was going to happen overnight, and that we were going to just see this mass array of devices solve everybody's issues. And as with any change in a market and technology, it's really turned out to be much more of an evolution than it has been a revolution. And it's come on fairly slowly. There's been some, I think I would say, hiccups in the OTC space. And I think one of the things that I've sort of talked about is also who's going to survive. And Darwin sort of says the one who's most adaptable to change is the one that survives. We've already seen several companies come and go already in the short 15 or 16 months or that we have OTC devices on the market. It's not an easy market to be in for some of the reasons that Barbara was mentioned. People are going to try these devices and they may not be successful. The stigma associated with it. We'll talk a little bit about what some of those devices cost, and that may enter into it as well. So I think we are going to see companies come in, but we're also going to see companies go out, and I think the ones that survive will have the technology, the services, and the platform that allow people to succeed in the OTC space. The prescription space, I think, is also an interesting part, because that's there was a concern there that we were going to see this massive, if you will, the prescription side. That hasn't happened. And I think there's some interesting developments in that side as well that we will hopefully touch on, because I think the whole market has been impacted both in positive and negative ways. So again, we talked a little bit about the path to get here. The perceptions were that hearing aids were very costly. You could only get them through a professional. The growing comorbidities, I mentioned some of those. There's a big concern among many of us in the audiology space that some misinterpretations of some of the recent data is being used a little bit as, and I'll just use my words, techniques that if you don't treat your hearing loss, somehow you're going to end up with dementia, Alzheimer's, or other horrible things. There is some linkage and comorbidities and other issues surrounding treating hearing loss. But be wary of ads or materials you see that indicate that if you don't treat your hearing loss, something horrible is going to happen to you. So Medicare obviously excludes hearing aids and exclude them. The devices and services, there is some thing that can be reimbursed through Medicare on a referral from a physician. We are seeing coverage of hearing aids, certainly in the Medicare Advantage space. We've heard some rumors and seen news about OTCs being covered, and we can talk about that at the end. But again, there's other coverage in Medicare for other devices, and as Barbara mentioned, for implants and other osteo-integrated devices. So there are some states that do cover hearing aids for children. We see a lot more of that in some of the state coverages. So now that's here, OTC, what do we need to know? You know, we talked about this. Are they right for you? And I think part of what we need to do as we start out on this journey is find out what our expectations are, what our needs are, and do you fit in a category? There are limited adults over 18, and there you see the issues we already talked about. If you're having trouble hearing in noisy places, meetings, restaurants, following groups, trouble on the phone, listening makes you tired, you could be in that mild to moderate hearing loss group. And I have that in italics because, again, as you heard earlier, this is, according to the FDA guidelines, perceived, your own perception of your hearing loss. We do know that many people underestimate their hearing loss by a number of studies that have actually had people indicate what they think their hearing loss is, and then they get a hearing test, and we find out they have maybe significantly more hearing loss than they're ready to admit for. That also comes along with the issues of the stigma. So we saw these also, the red flag conditions. I think it's worth repeating. If you have any of these kinds of things, neither OTC nor prescriptive devices are probably the thing you want to start with. You should see first an ENT would be preferable, but at least your own personal physician if you have or see any of these kinds of conditions, because these are all medical issues that probably should be and must be taken care of or ruled out prior to you getting into any hearing aid journey, whether that's OTC or prescriptive. Especially obviously.
Fine. The woman is the one I wanted to hear. He's just talking about over-the-counter hearing aids.
Okay, somebody's unmuted here. Okay, so these are some of the conditions, and again, just beware of these red flags. In regards to the devices themselves, there's a lot of things in the very long document with the FDA, but for me, the most important one is related to the return policy. It is not required or mandated in the FDA regulations that the manufacturers or the distributors provide a return policy that means you can bring the device back. And I mentioned both because it depends where you get the device. The device, if you buy online from a manufacturer, from a distributor or whoever online, that person, and if it's the original manufacturer, they may provide a warranty. Another example would be that you could go to a big box store like Best Buy. We'll show you the devices in a second that they have. The question that comes up is the return policy from Best Buy, or is the return policy from Whistle-Tone Hearing Aids? I'm not going to name names of companies here, but who's offering the return? Best Buy certainly would have you bring it back. And then the question for the Best Buy executives is, what do we do with those devices? Can we send them back to the manufacturer? That's not as much of your concern, because what you want to do is be able to get it back, take it back, and get your money back if it doesn't provide you benefit, if it doesn't work for you, hurts your ear, for whatever reason you're not successful. Make sure you have that. And also, be aware of how long and what the conditions are for that return. It could be 60 days from the day it ships from the person you're buying it from. And if that's online, that's the day they take your credit card. And let's assume it's the 1st of February and you have 45 days. Then by March 15th, that device has to be back in their facility, not leave your mailbox, but be in their facility. And we've heard some people kept them right up to that day, sent them back, and they said, sorry, you exceeded the 45 days because it had to be back in our facility. So be sure of the conditions under which you're purchasing. It's always, you hate to say this, but buyer beware. But again, I've heard from folks that have really been very disappointed, and now they end up with a device that doesn't give them any benefit. So be sure that you have it, and it has to be stated on the outside of the box, whether there is or not. They can state that there is no return policy because, again, this is not mandated and part of the FDA regulations. If you're wondering what the device is, these are the product codes from the FDA site. You can go to the FDA, you can search product codes, and if you put in these little 3 letters in there, you'll bring up a very long list of all the devices that are in each of these categories. For our discussion here, the ones we're talking mostly about are the ones that are over the counter. So if you start at the top, you see we've got QSM, which are these are regular hearing aids with wireless technology. However, those are prescription. Self-fitting air conduction devices that are prescription. There is a prescription self-fitting category. Wireless over-the-counter, QUG. Self-fitting over-the-counter, QUH. Hearing aid, air conduction, prescription, ESD. And the last one, QUF, is hearing aid, air conduction over-the-counter. That one, you may notice, is a little different because it doesn't have wireless technology, meaning that the device can either communicate between the 2 devices and or has wireless capability for you to use on your phone, iPad, or other devices. So again, it's important that you know what type of device you're buying, what features are in there, and if you're unsure, these have to be at least registered with the FDA. The ones that are self-fitting and the prescription ones, especially self-fitting devices, must be filed what's called a 510K or pre-market notification. They have to provide some data. Everybody else just has to register and indicate what the device does and what the features are, which then allows the FDA to assign it to one of these codes. So I think you're probably going to look these up, but this has come up recently in regards to some of the reimbursements that's being done for some insurances and federal employees. Specifically, I was on a call the other day where they were denying reimbursing devices. Unfortunately, they were using the wrong database to look them up. And so we provided the correct database. And so again, you just want to make sure which device you're getting, and is it really one of these self-fitting over-the-counter. So we already talked about what the goals were here: access, affordability, and innovation. We'd hoped that these would be the things that would come about. I think accessibility has improved. I would give that an approved rating. There's at least 40 companies selling OTC devices, and by my last count, over 80 have filed applications or are in the process to go through the FDA registration or pre-market approval process. So there's a lot of choices, and that may be good, may be bad. Whoops, we need to go here. Where are these things going to be sold? Lots of places. You can get them through hearing professionals. Can dispense both OTC as well as prescriptive devices. Retail stores, places like Best Buy, etc. You may see also there's some of the phone stores, Verizon, some of their franchise systems called Dixa are having devices. Some pharmacies have already started, and online as well. You can buy direct from the companies and or manufacturers. These are not PSAPs or hearables. Okay, there are a couple of categories here: personal sound amplification products, or PSAP. These sort of used to be OTC devices without the name before the regulations came out. These now, we have a separate guidance document from the FDA that indicates that these are not intended. That's the phrase the FDA uses, is the intended use of the device. These are not intended to be fit on or marketed to people with hearing loss. These are things for listening to birds if you're out hunting, or you want to listen in a, someplace that they're not intended for people with mild hearing loss. Now, they could be used by them, but the marketing, and which is really important, the FDA has sort of restricted that so we don't end up people trying to buy a PSAP that really is not an OTC hearing device. Nor are they hearables, which are the AirPods and buds and all these things. If there are some earbuds looking devices, and I'll show you a picture in a second, that are actually hearing devices. So again, you see where this confusion starts here to mount up, is that we have devices that are in a hearable category, so kind of like these little white things everybody's got hanging out of their ears all the time, are not necessarily OTC hearing aids. Those are just referred to either as PSAP or hearables. They're not intended, again, for hearing loss. And I made this little sign, a little chart you see here at the bottom. If you go into your local pharmacy, that used to say, I forget what it used to say, aspirin, but I put my little sign in there that said hearing aids, that you would find a little shelf there that you'd go and you could pick up your hearing aids. So what kind of devices can you get in various retail establishments here? This is reasonably current. They do come and go, but Best Buy has a pretty broad selection, as you see here. Eargo, HP, which is a company also with Nuheara, but they're called HP. Jabra, Lexi, Lucid, primarily we see those in some of the Sam's Club stores, Sennheiser, Sony, and Williams Pocket Talker. Some of the others are also sold at CVS, either in the stores or more so online at their CVS.com. Same with Walgreens and Walgreens.com. And then within the Verizon environment, phone stores, Victra, which is, again, I mentioned their franchise systems, not the company-owned Verizon store. Eargo did have an arrangement with them. I haven't quite figured out or been able to get anybody to verify whether that's continuing. Eargo, as some of you may or may know, had some legal issues with the Department of Justice. They sort of became private. They had a private equity company that bought them. They've been pretty quiet for several months now. And I just saw something they're going to re-release products fairly shortly. So you may or may not find Eargos in either of those two places based on their upcoming releases. Will you find these, and again, in hearing professionals' offices? In some ways, this presents a little bit of a dilemma based on how the FDA guidelines were written. And my way of explaining it is, if someone would come in and decide they'd like to get a hearing test to see if they needed a hearing aid, again, forget about who pays for it, insurance, but just the process, then I could say, yeah, I'm happy to do that. Hi, I'm Dr. Powers. I'm an audiologist. I'm in my white coat. I test your hearing. I explain how prescriptive hearing aids work. And then you say, well, I'd like to think about those OTCs. Well, in theory, what I could do is run in the back and get my blue coat that has Tom on it, because, I don't want to be portrayed as an audiologist, because that implies some things related to the licensing, relates to warranty, et cetera, et cetera. So not that people are going to run and change their coats, but you can see the dilemma. We did some surveys, some folks, I didn't, but a friend of mine did, who's an audiologist out in Colorado, as well as Hearing Tracker. And whether audiologists are carrying these, I think, has a lot to do with whether or not these will explode, if you will, into the market, because not everybody knows what an audiologist is, but they certainly know that that's the hearing place. And you can see it's pretty consistent here. About a quarter of hearing care professionals and audiologists decide they're going to sell OTCs in their practices. And again, there's nothing in the rules that says you can't do that. We can't require an audiologist to be a part of it, nor can the audiologists themselves require you to take any services other than the cost of the device and the hearing test. About half of them, 55% in both surveys, said they would support patients who came in with OTC devices to provide some level of support. How to get it in your ear, maybe batteries, rechargeables, counseling, where to sit when you go to dinner, etc. And some decide they're going to start to unbundle their pricing structure. And this was a big part of the discussion, and Barbara mentioned many of the meetings we all attended when this was leading up to it, the FDA, the FTC, National Academy of Science, Engineering, and Medicine, was why are hearing aids so expensive? And part of the issue is this unbundling concept where the price of the device and the price of all the services is all bundled together. So it's hard to figure that out, but also leads to the perception that the entire $5,000 or $6,000 that you pay is only for the devices and not for both the devices and some professional services, including testing, follow-up, coming back, adjustments, etc. Again, so this unbundling concept is something we see starting among the audiology community, which I think provides a pathway for people that want OTC devices to get those devices and some minimal services on how to use the device without having to buy into the whole process, if you will, related to getting a prescriptive device. Now, if you have more than a mild to moderate hearing loss, you are into the prescriptive side. And that may also be unbundled, where you buy the devices and you decide how much services you might need, especially if you're a third or fourth time purchaser of hearing aids. You may not need as many services, but that's up to you, and it's up to how you feel and how much help you need and who that audiologist is and what they're providing in the way of services. One of the issues, of course, is who's selling these devices. Market Track, which I've been involved with for the past 3 or 4 years, and published the data with a bunch of other authors and seminars hearing. But one of the questions we've asked consistently over the past several market tracks is, can you tell us the name of the hearing aid you want? And as you see here on the left side, 71% didn't know the brand of the device they were wearing. And when you ask them, well, what do you think it is? Most of them gave the name of the practice. And the ones that thought they know the brand might have known their brand. They also gave some pretty weird names. And a lot of these are companies that I know and have friends there, but just as an example, the company out of Minneapolis called Starkey with an ST, people report that as Starkey. There's also a company right over there in Long Island called Widex, and many people thought they were wearing a Windex hearing aid. So we gave them credit for that because it's pretty close. But as you can see, so what you see then on the right is now we have some of the major hearing aid brands who now have either brands that they use for other technologies. GN is an example, Great Nordic. Jabra is their brand of headsets and headphones. So now their over-the-counter devices carry that name. Nuheara was a hearing aid company started a while ago, who's partnered with HP, Hewlett-Packard, to provide the earbuds that you see there. And again, consumers know HP. Sonova, which many of you may know as Phonak, but Sonova out of Switzerland, purchased and now uses Sennheiser, a pro audio name, for their devices. And WS Audiology, Widex, Signia Audiology, has partnered with Sony to do that. I think a lot of that is driven from this other part of the slide, where consumers would have a little more confidence, I think, purchasing an OTC device from a company they would know, much like if other big companies would come in this space, Apple, Google, and others. People might think, well, okay, they've been around a while. I don't know this other company. So some of these brand partnerships we'll see, although the data from the hearing aid manufacturers, those numbers are fairly small, but that relates primarily because they sell to the professional. And as you saw in the previous slide, 100% of the hearing aid professionals are not selling OTCs, which limits their distribution. So it's we'll see how that part of the market comes to play. So affordability, so that's the access part. So affordability, these are the, these are the companies that are out there as of about a month or so ago. I keep a running list. And I've broken them up into three buckets: under $400, $400 to $1,000, or a little less than $1,000, and over $1,000. And you can see the list gets pretty small as you get to the higher cost devices. There are some in there in that first list for $89, $99, and one near the bottom also for $89. I don't want to. I'm just going to say those devices probably have not as great sound quality. Probably has some that have much higher cost, because these devices require reasonable microphones, receivers, chips, etc. And it's pretty hard to put together a high quality device, whether that's an OTC or a prescriptive device, at that level of prices. And so somewhere in the middle to upper part of that lower category, there's probably some reasonable prices. The ones in the middle, I think, are probably closer to devices that, if I was going to get them, would be there. You see $689 up to about $899, $999. Of course, that was my break point. And then over $1,000, to the right of the screen, there's a pretty big range there, from $1,059, Olive Union company out of Asia. Some of the ones you already mentioned, Ergo, audiologist, America Hears. The one at the bottom, Blue Moth, is primarily a retail company or an audiologist who's selling devices online, but with services. So in essence, that 5,000 is probably more comparable to prescriptive devices, but they're listed as OTC, so they have to be in this category. So as you can see, there's a pretty wide range here. And while a lot of people, when the regulations went into effect, thought that there would be a lot of maybe really good quality devices in that first column, it hasn't really come out. And we'll see if that gets better as we move forward. But a wide range of prices, and I'll leave it at that. How will insurance companies view OTCs? Will they cover both? We don't see that much as of yet. There has been some discussion. We've heard from some of the major manufacturers, Blue Cross, et cetera. Would they move into that through hearing and some others? It's a concern among a lot of people because of the cost of the devices and also the reimbursement at the professional level. Because most of the insurance coverage goes through professionals, whether it's an audiologist or hearing care professional. The devices come from the insurance company, and then the professional is paid a fee for fitting those devices. So we'll see how that works. It certainly would work to the insurance company's advantage, because as you see, even if they've got pretty good devices in that middle category, from a cost perspective, it would be less than buying two high-end prescriptive devices. So we'll leave it at that, and we'll see how that whole thing sort of pans out here. As we said, traditional Medicare doesn't cover these, but Medicare Advantage does cover hearing aids, vision and dental. You see the ads on TV. There has been some requests from Congress to understand exactly what that means. Not all these plans are identical. Some are really just discount programs. They're not really providing full coverage. So you might have a copay of $1,000 or $1,500. You might not have much choice on the devices that you get, or even where you go, because only someone who's in the network or in an in-network provider can provide those hearing aids. So there are some limitations here, and I know they're trying to look into the utilization of those. That's another concern of Congress of recent is this just being used as a membership draw by saying they have those benefits? Many people don't use them because later on they say, well, I'm too old, I really don't want to get that, I'll use that next year, and then they don't use them. And in essence, they're paying for them if they're paying whatever, $100 a month for that Advantage program. So it's an issue. Innovation. We haven't really seen a whole lot of innovation in the what I'll call the technology piece. I think there has been in another piece, which is the form factor or how they look. But most of these devices have the same basic or structure of technology that we see in prescription or RX devices. They have, a lot of them have directional microphones. They certainly have feedback reduction circuit or capabilities, noise suppression capabilities, rechargeable batteries, and wireless connectivity, again, whether that is between the devices, through the app, or to the phone itself and be able to stream your phone calls. So this, I think we haven't seen the level of innovation yet, but again, having worked for a hearing aid company for 30 years prior to starting this little company of my own, development is an 18-month to 2-year process. So even though you may have started developing before OTCs came, a lot of these we're not quite seeing yet. The existing form factors that we see in OTC look a lot like what we already see on the market, either a traditional looking behind the ear / RIC device, the one you see in the right upper part, Jabra. This is sort of an earbud hearable. Sony is on the lower left, so this is the device from WS. And then there's another just sort of stock device that would fit into your ear canal from one of the other manufacturers. So these sort of look like most of the rest of them. However, we do see some that are quite different, and whether these make their way into mainstream OTC, we'll see. The one on the top, on the left side of the top, is from a company called Overtone. It used to be called Decibel, but now they've changed their name to Overtone. They're out of the UK. The way that thing works, you see that little hook on the top fits over the top of your ear. The little round button in the center sort of fits just at the top. Whoops, I have to plug in my PC. Hold on a second. I forgot to do that. I'll be right back.
Tom, can I interrupt you for a second? I know there's going to be a lot of questions. There's a lot in the chat. So it would be good if we can move on to the questions pretty quickly.
And I just want to, Catherine, I just want to clarify, just add a few comments to clarify some things that Tom mentioned, which might answer some questions. Just quickly, okay?
Okay.
Okay, yeah, we're almost done. So the kind of form factors are there. This one is another one that sort of fits over your ear. And then recently we've just seen now a company from Italy, Milan, that's going to introduce later this year a combination eyeglass device. So it has hearing aid built into the temple and also eyeglasses. The one thing you will see there is no connection to your ear. The receiver loudspeaker is built into the temple, and the direct sound at your ear canal. And that's enough I'll say about that for now, but because they're not available yet, but they will be shortly. These are all the self-fitting devices in 2 different categories. They can be sold online or in retail. Self-fitting implies you can adjust them yourself and make some adjustments in the low frequencies, high frequencies, etc. We've seen people have limited success fitting them themselves. If we do probe mic measures, as Barbara mentioned, audiologists put a little microphone or tube in your ear and make sure that we fit these properly. You see that those lines don't match, and so that may not give you the benefit you thought you were getting. Nobody knows how many of these are sold. 100,000 to 1 million. So we really don't know. What we do know from some anecdotal data is they tend to be the younger buyer, OTC. They want a simple process. They probably are situational wear, so dinner, meetings, grandkids come, whatever. And the one thing that I think I want to just point out quickly, and I'll be done, is we've noticed a lot of bad actors here that have come into this market space, unsubstantiated claims. None of these devices can restore your natural hearing. You have a hearing loss, you have hair cell damage, you have issues related to your hearing. This is not possible, and if you see this, this is just not true. So don't be fooled by this. Also, this is a company that has even registered, didn't register with the FDA, and they're talking about OTCs going up to severe hearing loss. As you heard for both of us, mild to moderate hearing loss. This is the one I love. I really don't think the CIA has licensed technology to this company so that it can hear a whisper across the room. At least I don't believe so. And I do happen to have a friend from high school who does work at the CIA, so I know this doesn't work. And so just be aware of these crazy advertising that you see. So what have we learned? I think, we thought that, was this going to work? It's very early. We hope that it comes to pass, but we're not quite sure. I mean, I think time is going to tell how this is going to work and how this market will evolve from a technology and an affordability standpoint. So with that, I'll either turn it back to Barbara or we'll go to questions.
Okay, Barbara, if you wanted
Yeah,
to
I
clarify,
just-
and I really do want to leave enough time for
Right.
people to ask questions, because I
Right,
think
I just want to
a lot.
just say a couple of things to clarify. And, okay. So, in terms of, just again, to add to what Tom said. So in terms of, labeling, and this just want to add to this. The manufacturer, according to the FDA, the manufacturer must use clear, easy to read language on the box. If you buy it online, you might not see it, but on the box in a big box store that states the OTC hearing aid, that it's an OTC hearing aid, and the packaging must also include language that explains who the device is appropriate for and outlines parameters for when someone may need to see a healthcare professional. Also, in terms of the performance of OTCs, there's a limit in terms of how much they can amplify for safety purposes. Again, outside the box, it has to have information about the battery. On the box, it has to have contact information for the manufacturer, so you can call the manufacturer to find out what the return policy is. So the return policy may not be on the box, but the contact information for the manufacturer must be on the box. And you can call the company and find out what the return policy is. And then I want to add that in terms of the comment that Tom said about in terms of so far the advantages, there's a study that just came out of South Africa, and we know now from that study that people who have, in this study he had a large sample, people who did purchase OTC did it at a younger age. So we're seeing people who are younger embrace the technology, and people are waiting less time. The average wait for a prescription hearing aid is 8.7 years. In their study, people waited 4 to 5 years. So people are not waiting as long, which is really important because early intervention is important. I also want to emphasize that Costco sells prescription hearing aids, but they also sell the Jabra. And remember, Jabra is made by Phonak, and what we said here, GN Resound is Jabra. Phonak is the Sennheiser brand, and then you have the Widex, Signia is Sony. So the manufacturers are all making these to bring people in for identification of the brand, and also to get people in early. So there are positives and negatives. And I think that, and I just wanted to just quickly show. This is a little bit of a slide, and I could send this to you because I don't have time, but here, if you're interested, I can share this with you, a comparison between OTC hearing devices and prescription hearing devices. So you can see the difference. Primarily prescription devices fit by a licensed audiologist, OTC by yourself. Price ranges for prescription can go up to $7,000 for a pair, but it starts at $1,000. So you don't have to get a high-end hearing aid from an audiologist. And some of those low-end hearing aids are going to cost the same as an OTC device. So yes, you can spend the same amount of money. In terms of return policy, I mentioned that prescription hearing aids required to have a warranty period and a return policy. And then, so this is just some overlap. Again, here, 18 and over is the for OTC and non-OTC. Then I want to just say, hearing aids are not a cure-all. Hearing loss cannot be cured. And for people who get hearing aids, for people who get the over the counter, as you know, you have to be patient and you have to be motivated. These are some of the traits associated with people who are successful. Do I have that? Maybe not. I don't have that. So, but I want to also emphasize that audiologists not only sell hearing aids, because I did a presentation at HLAA several years ago. Not only do audiologists sell hearing aids, but we also do screening. We also help manage. We also do rehabilitation counseling to help people adjust to hearing loss, help improve communication. And we encourage people to come back to the audiologist for serial monitoring. So the audiologist wears many hats. So it's important that you know that we do more than just sell hearing aids. And what most important that audiologists must recommend is when you're getting your technology, you have to stay connected. We want to socially prescribe. We want to encourage everybody, as you folks here know, to stay connected, to stay engaged, because that is really the bottom line in terms of longevity and in terms of cognitive and in terms of auditory wellness. And now I think we're ready to take some questions. And I have my
Okay,
email here if anybody-
could you take down your, thank you very much. So I'm going to call on people in order, but I want to first to both of you, a couple of people in the chat have asked if you could make your slides available. If you don't want to make the whole pack available, maybe you could do just a section. And for anyone who would like to get those slides, depending on what Dr. Weinstein and Powers provide, write to info@hearinglossnyc.org. That's our website, and it's just info@. And I answer that mail, and if I don't send you the slide pack, email me again and I'll do it. Janine Katomsky, did I get that right?
Oh, hi. Can you hear me?
Yes.
Yeah.
I'm sorry. I'm Janine Katomsky. I'm president of Eastern Connecticut HLA. And I actually just had a couple of comments, not questions, about dementia being related to untreated hearing loss. I don't agree with that. My personal feeling is that dementia has two basic causes. One is aging, and the other is social isolation, which comes from people not being with you if you have hearing loss, whether or not you wear hearing devices. Okay, now I think prescription hearing aids and OTCs are fantastic if they can help people. But I wish audiologists would understand, even if somebody gets evaluated and tested, I can't tell you how many people I have met personally and in social groups online, in hearing loss groups, have said they've tried hearing aids, they've tried different brands, different adjustments, tried them for years, and they still have trouble with speech recognition, understanding people. It breaks my heart. I keep hearing this from everybody. Audiologists, please remember that there are people for whom hearing aids amplification does not help you understand people. They have to encourage people as backup, like we're doing here. We're using captioning and technology instead of making those people feel frustrated, upset, or like failures. And the over-the-counter hearing aids, I do have a quick question. Is there any liability on the part of the audiologist that tell the patient, sure, I checked you out, go ahead, go get an OTC, or the OTC companies should, I know this has nothing to do with the return policy, I'm talking about liability if for any reason the OTC damages or harms the person's ears, the hearing.
Hey, Barbara or Tom, do you want to answer that about liability on the, Barbara, you're there with your hand raised. I guess that means you want
I was
answer.
gonna make a different comment.
Okay.
Tom, you want to answer that liability? Then I was gonna add a comment to what you just said, Janine, or should I? So let me just comment. So I have slides on the fact that hearing aids are not the only intervention. Communication strategies is important and captioning is important. And I had slides showing you the value of mobile captioning technology, which I just completed a study showing the many advantages of mobile captioning on smartphones. But I want to suggest and I want to encourage everybody that if a hearing aid is not working, it's really important to go back to the audiologist because there are things that can be done. There are adjustments that can be made. As I said, people's brain, there are changes in the brain so that sometimes the signal not negative, not dementia, but changes that occur normally with aging. Sometimes the signal processing is too much and the audiologist just has to turn back the signal processing. So audiologists can make adjustments. So it's really, really important to know. I mean, we're not the solution to everything, but there's a lot of different things that we can do to help people. So
I
it's
put
important
these in
not
now,
to give
but
up.
now I'm not hearing anything.
And it's important to, stay connected. Again, the captioning, I have great slides on that and I can share those with you. And also communication strategies are very, very important.
We actually are, I forgot which meeting it is. I think it's April, have a meeting totally devoted to captions on smartphones, in public places, on television, movies, and so come back for that meeting. I can't remember which month it is. but
April.
it's April.
April.
Thank you, John. Okay, it's April. I think it's going to be it's a good counterpart to this meeting. So, Ellen Summel. Ellen.
Hi, I unmuted myself. I just have two quick questions. I myself can never use over-the-counter hearing aids, but since I'm sort of the guru in this multi-complex where I live, people are forever asking me. So I was curious to know, first of all, you used PSAPs and hearables. I don't know, are those interchangeable or are those two different kinds of things? That was my first question. My other question is, I believe, and tell me if I'm correct, that the over-the-counter prices are per pair of hearing aids, of over-the-counter hearing aids.
The pricing that you see on the slide that I showed are for the most part per device.
Oh, per device.
So if you see some of those $89, it's times two for most of them. And again, you have to look to the website to see there are some that are for a pair. So you go back to your first question. Hearables are different than PSAPs that are different than OTCs that are different than prescriptions. So we basically have four distinct categories, if you will. Prescriptive devices are sold by professionals. OTCs you can get yourself. PSAPs you can buy, but they're not intended for people with hearing loss. The FDA has made this very clear. Hearables are the things most people wear on the train and subway and riding around, those little AirPods that you want to listen to your music. But again, these are not intended as a device that's going to help somebody with hearing. They may have some features of noise reduction, but they don't. And one last thing, going back to the liability issue, one of the things that does have to be in the documents coming with an OTC device, the FDA did mandate this in the guidelines, is that if you have an injury or something happens while you wear one of these devices, the FDA mandates that in the owner's manual, there is
prosecutors say the suspects did not know
that device.
each other when they got into an argument at the end of the parade and started
Can you mute yourself?
shooting. A radio DJ and another were standing in the crowd. Two other minors.
Is that something? Okay.
Okay,
Yeah.
good.
So, and I want to just add in terms of the hearables, those of you who have a smartphone, Apple smartphone, you can convert it into a hearable using what's called an app called Live Listen and your AirPod. So this can be used as a hearable if you have an AirPod or a headphone, and then you just turn on Live Listen, and it actually can become a hearable, which is kind of interesting.
You.
Catherine, you're muted.
John, do you want to ask a question?
Well, no, I just want to second what Barbara was saying about going to back to your audiologist if you're not happy. That's why you're paying so much for the hearing aids. That's why that's part of what you're paying for. But it's not just good enough to go to the audiologist and say, I'm not happy. My father, at the end of his life, I would take him to the audiologist. He would say, I don't like it. And the audiologist would say, what don't you like? He'd say, I don't like the sound. Well, that doesn't give the audiologist any clues as to how to help. So I would encourage people, when you get new hearing aids, to try to be descriptive. Maybe you can say it's too echoey, it's too percussive, and to possibly keep a journal of what situations you're having trouble with. And that will help your audiologist help you. It's a two-way street here. And then the other comment about what Janine said about dementia, I think that it's been pretty well established that there is an association between hearing loss and dementia. The jury is still out on causation, and there is research going on about that, but there is very clearly an association. So I just wanted to clarify that. That's all.
So I want to add to John's comment. I've been one of the vocal people, and I concur with what Tom said in terms of correlate. There's an association, but there's no data really showing a cause and effect. And the scare tactics that are being used are not good for hearing aid users. They're not good for people with hearing loss. And I've been a very vocal person in terms of writing a lot about it with a colleague, Jan Bluestein, who's a member of Hearing Loss Association of America. So there's a lot of, and there's a lot of misstatements, a lot of smart social media misstating things. And there was just recently a retraction from a scientific journal where the journal concluded that hearing loss and hearing aid use prevents dementia, and they had to retract it because there were problems in the study. And that's a very didn't get the social media attention it should have, but we still don't know. And again, association, as John said, does not mean causation, as Tom said.
Let's thank you, Barbara. And if anybody wants to read the paper she wrote with Dr. Jan Bluestein, again, write to info@hearinglosnyc.org, and I can give you a link to that paper. One of the things that is constantly repeated is that if you think you have hearing loss, if you think you have mild to moderate hearing loss, there are ways to test that, right? I mean, is the National Hearing Test still something that you can use?
So, Tom, you want to talk a little bit about
2 or 3 years ago, there was a lot of noise about a national hearing test. I think it's administered through AARP. And I understood it to be very effective, just to give you, sort of the ballpark. And if it turned out that you were doing badly on that test, which is on the telephone, then you were, suggested that you go to an audiologist. Is that still available, or how do people know that they have mild to moderate hearing loss?
So Tom, you want to talk a little bit about the hearing handicap, the stuff that you've done on, that we've done. So that would be, then I'll answer.
Yeah, we have a pilot that we've run on the Hearing Industries Association website, where we have the hearing handicap inventory screening, the 9-10 question quiz, if you will, to evaluate the environments and places that you may have difficulty. And what we're seeing is that there's it parallels what we see at Market Track and other data. And that is, if you take that quiz and it gives you a score at the end, it's pretty accurate in terms of predicting whether you're in the mild to moderate, or to severe category based on the environments that you're struggling in. Now, I've taken, as a part of a little project that I'm working on myself, about 15 of the online hearing tests, and I can tell you they don't overlap to the professional hearing tests that I've received from two of my colleagues here. Some of them are reasonably accurate, some are way off. And so, part of the problem is calibration. One through the phone, of course, that's a problem because many of the phones have a very limited bandwidth. The other issue is we don't know what headphones you're wearing when you take that test. And so we can't calibrate those to know that really it is 50 dB coming out of those little headphones and it's not 30 or 70. So there is one approved from the FDA, but that's it. The rest are, I would say, approximations at best. And I'll let Barbara comment as well.
Yeah, the only thing I will add is that the person's self-perception of the difficulties, which is why they say self-perceived mild to moderate difficulty, that's going to really pick up the difficulties. If somebody admits to having difficulty, that means that they're most likely ready to embrace some form of technology. Some of these hearing tests are still going to miss people that have hearing difficulties because these hearing tests, some of the hearing tests are not picked up by our tests, which just test the ear, the outer middle, the peripheral mechanism, the outer middle and inner ear. We don't pick up the processing problems, the understanding problems that come from people cannot understand information once it gets up beyond the ear into the brain. So the self-report is the one that Tom just talked about is pretty accurate in terms of who's going to benefit and who's going to be a candidate.
Could you put in the chat what that test is that you're referring to?
Yeah.
Okay. Rosemary Bove.
Oh, thank you. And congratulations on pronouncing my last name correctly. You must have French in your background somewhere. Anyway, a quick question. I found a website online called Hearing Tracker. It's one word, hearingtracker.com. Is anyone familiar with that? Because it looks like they're giving reviews of OTC type devices as well as the hearables and the other ones.
Yeah, Tom mentioned Hearing Tracker in this presentation. Yeah.
Oh, we did. Oh, thank you. I missed that. I'm sorry. I apologize.
That's okay. Yep, they do a pretty good job. They've started testing a lot of devices. They've got some files there that you can listen to. Again, if you record a device through even a mannequin in a really great environment, and then replay those sound recordings back through the little tiny speakers that you have in your computer, they may not sound real great, but at least it's an indication of what that might sound like. So. Yeah, they have a lot of great information. Abram Bailey, I know Abram who started that, and they've a lot of good information. Again, I like their audio files in terms of at least providing you with a reasonable comparison between devices.
Okay, that's very useful. Thank you.
Hearing Tracker is associated with HLAA National. So if you go on the HLAA site, it's hearingloss.org, very similar to ours, but without the NYC. That will take you straight to Hearing Tracker. Thank you. You finished? Okay. Janine, I'm going to skip over you to let Damus Simon have a chance to ask a question. Then we'll come back to you. Dana, are you there? If you can turn your video on too, that would be a big help. Okay, maybe you're not there. All right, Janine, you can ask another question, but I would really like to ask that we leave dementia off the table for right now, because really we're here to talk about hearing aids. Okay.
Never mind. It had to do with that. I'll respect your request.
Okay. Yeah. We are thinking about having a chapter meeting on this topic, but it's so naughty right now that we just haven't quite gotten to have it yet. So Diane Rolls, if you would like to speak, you're muted, and if you can also make yourself visible, that would be great. There you are. Thank you.
Thank you, Catherine. I have been to I think they made me see 5 different doctors. I have hearing loss. And they've told me my next step is to see either an audiologist or look for OTC. What do I do? I have no idea how to approach. I mean, they said, call your insurance company. That would be Medicare and AARP and see if they cover anything. But aside from that, how do I start?
I think that's a very good question. And that we tend to sort of move. I mean, what do you, Barbara and Tom, suggest? Should she go to Best Buy and ask them what they recommend? Should she go to CVS and see what's on the counters there, if there is anything? I go to CVS and I haven't seen a single over-the-counter option anywhere.
Yeah.
So this is, this is really the basic information. Do you have an answer to where you start?
Well, my suggestion would be, I just put in the chat, the betterhearing.org is the name of this is the site. So if you go to betterhearing.org, you'll be able to find, which is, where you could find that screening tool. That would be the first, I guess, one way, if you don't want to go see a person, that you could at least take that screening and find your score. And if, it's, a very high score, chances are you really should then direct yourself to a hearing professional. If your score is, 0 to 10 on this, that means you probably have a mild to moderate hearing loss, which would mean you would probably, I know all these qualifiers, probably do well with an OTC device. We can't guarantee that. So I think that's one way to do it. The other would be if there is an audiologist close by, you can call and ask them, and they can just do a basic hearing test, and then you'd know exactly where you are. But if you don't want to take that step, I would take the step to take this screening tool that I think is going to give you a pretty accurate area of the range of your hearing, mild to moderate, or to severe. And now you at least then can say, well, okay, those top 2 categories, I'm going to see a professional.
You hear me?
That answer the question? Go ahead.
Yeah, I have technical difficulties. Hi. So I have a cochlear implant, but I came on here for a relative. And I know a lot about hearing aids before my CI, but they're all in Manhattan. And this relative had a stroke, and it's very difficult to get them into Manhattan to see an audiologist. So they're in Brooklyn. And so the whole, they had a stroke and not mobile. So that's why I thought over the counters might be helpful, but even that is complicated if somebody is elderly, how to figure out what's best for them.
So I can, if you want to contact me, I can give you the name of 2 audiologists that do remote teleaudiology, and they can help you as a start. And also I have a former student who has offices in Brooklyn, and he may do home visits. But the 2 audiologists that I'm thinking of do home visits, and they start with teleaudiology. So if you want to contact me, I'd be glad to get that
Who's this?
information.
I have a vision impairment. Who is
Oh,
this?
sorry, it's Barbara Weinstein.
Barbara Weinstein. Okay. All right. Thank you, Barbara.
Okay, I think we have time for one more question, and that would be Beth Friedman.
Yeah, I have a question for Barbara. First of all, Barbara, I remember you. I'm a retired speech pathologist.
Oh, okay.
But that's about my question.
And that's what people say. You're still doing this, Barbara?
My audiologist said that the manufacturers such as Oticon, which is what I have, keep improving their hearing aid technology. So she recommended to wait until the spring, I think she said, when they come out with the latest version. And I wanted to know your opinion on what she had to say.
Well, let me just ask you, Tom, you can handle the question, but I just want to ask you, Beth, when did you get your most recent Oticon hearing aid? How old is it?
5 years ago.
Okay.
Okay.
So Tom, you want to?
Yeah, yes, there is a fair amount of, improvement in the devices. In the U.S., and because I worked there for 30 years and was responsible for it, the VA is the second, or is the largest purchaser of hearing aids in the United States. Okay, they buy 800,000 hearing aids, and our veterans certainly deserve them. So their contract, where I'm going with this, is their contract comes up in May and November, and you must have your device available 2 months prior in order to be on the VA contract, and all the major companies are on that contract. So if you're curious about when technology is going to be introduced, it's March or September, because you have to have it out before the VA contract. So I noticed that this month, anybody who's going to, Oticon just launched a new product, VN introduced a new product, and my guess is those are in anticipation of being on the VA contract. If any of you are veterans, first, thank you for your service, but also, you could see those new devices starting in May. But that's part of the reason why they talk about waiting, is most of them know that that's when those releases take place. So if you are interested in buying it, and I would say yes, 5 years is probably time for thinking about new device, because I think the receivers and things can be replaced. But as your hearing loss changes, you may need more technology, better directional microphones, better noise reduction. Again, all those are the things that get improved through more power in the signal processing chip. So that's the reason for the wait. Yeah.
And I want to also add that a lot of attention is being devoted by the manufacturers to noise reduction to help more and more people with their major complaint, which is speech understanding of noise. And the other thing is many audiologists attend a national meeting in April, which is when many of the manufacturers introduce the new technology. So if you wait until about that time, April, May, then many of the audiologists will have learned more about the technology, and they'll be better suited to help you.
Yep.
Thank you. And if the VA is the second biggest purchaser, is Costco the biggest? Or what comes number one?
Costco's up
The
there.
VA is number one, and Costco is number two.
Right.
Okay.
So Costco, I just want to emphasize that Costco, again, prescription hearing aids, people think they just sell the PSAP. No. They sell prescription hearing aids.
Yes, they sell all the brands
All
that
the
you can
major-
buy
the
at
manufacturers,
private audiologist, I think, right? Barbara, okay. Okay, we have to sign off now. But I want to thank everybody for coming. I hope that you'll come to our next meeting, which is, our meetings are always the third Tuesday of the month from 6 to 7:30. You can see the list of what we're presenting the rest of this season through till June on our website, which is hearinglossnyc.org. And I did put that in the chat, and it's also the best way to communicate with us if you want to get some information from the chapter. So thank you so much to both our speakers. This was great. And I think we all probably could ask another hour's worth of questions, but we won't. Right. Thank you, and goodbye, everybody.
Thank you for your attention.
Thank you.
Thank you.